It's all about humanity. About humanity.
I could agree on abortion to some extent, and always understanding the circumstance why women gravitate towards the abortion when there are other options available. I do agree on abortion to some extent, but to come to this conclusion, it's necessary to understand the difference between a normal miscarriage that occurs when the embryo detaches from the uterus and therefore gets flushed out through the birth canal, compared to a surgical termination, also called a DNE, where the surgeon uses a grasping clamp to amputate the body parts of the unborn fetus, where ultimately the area of the head is crushed with these clamps and also extracted. It's always logical to understand the difference between a birth and a termination, where in both cases the fetus is extracted from the womb. During my time as a physician's assistant, the most horrible case I had ever experienced was a 12-week DNE, where not only the baby was killed, but the woman also died of internal hemorrhage. She had to be airlifted and was pronounced dead on arrival after she ingested aspirin as part of her desire to terminate the pregnancy. This is a 12-week fetus, already and fully developed inside the womb, before getting destroyed with these surgical grasping clamps. And this is the same fetus, incised and excised as a specimen right after the DNC. See, there is DNE and there is a DNC. This was a DNC. This is the reason why women need to sit down and understand the facts. Okay, what's a DNE? And how the surgeon proceeds to extract the fetus compared to what is a normal cesarean section where the baby survives. When a woman suffers gestational hypertension and she requires an emergency cesarean section, the baby is removed from the uterus. Like any other baby has the probability and possibility of surviving. Unlike a DNE procedure, where the surgeon has an option of using a suction machine, depending on the size of the fetus, and or an instrument to grasp and amputate the specimen into recognizable pieces like arms and legs. Basically, if the surgeon uses a suction unit, it means the pregnancy where the embryo has not developed into a fetus. This would be an acceptable termination, in my opinion. When the surgeon has to use the famous grasping clamp, it means that the fetus is already developed, and to extract the specimen from the womb, it must be crushed and amputated into pieces. At this late stage, I have to say, it's totally unacceptable. Women need to understand their menstrual cycle to avoid this unpleasant inconvenience. Most women have basic knowledge of contraceptives, however, and successfully end up getting pregnant. I'm going to explain how a woman gets pregnant and what she needs to do to alter her 14th day of ovulation, which is the day she gets pregnant. Okay, women are different. Some has normal menstrual cycles, while other women has abnormal cycles. Why? Pathological. Because of the excessive bleeding, leading to a low level of red blood cells and therefore becoming anemic. Okay, a normal cycle is always consistent where the woman's hormones are secreted at the right time. If you are a normal cycle, it means you bleed every month exactly or close to the same day, where the normal bleeding should take between 4 to 5 days consistently. Unlike the ones that bleed irregularly, these are the ones that are prone to get pregnant more easily and regardless of their ovulation period, unless they use contraceptive pills that will regulate their period. When there is sexual intercourse, the sperm travels from the entrance of the uterus to the ovary that is releasing estrogen on the 14th day of ovulation for the process of fertilization, where it takes about 1 hour to go from this area here, outlined in red, to this area here, also outlined in red. This is the only area of estrogen where the estrogen is secreted, where the sperm and ovum must fuse together to form the first stage of the embryo called the zygote. The zygote then must travel from this area of estrogen back to the area of the uterus in about 5 days. And during these 5 days, the zygote will turn multicellular and turn into what's called a morula, or the last stage of the cellular process, where with the help of a hormone called progesterone that will be secreted, will embed onto the endometrium of the uterus, and this is what's called an official pregnancy. So a woman has 5 days to decide how to manage her pregnancy and stop it if desired. But this must happen prior to the embryonic stage, which is when the morula embeds itself onto the endometrium. Okay? When a woman has her period, this is what occurs at a molecular level. And this is the part that emphasizes the difference between a cell that has been attached onto the endometrium or a cell that does not attach at all, forming what is called the period of bleeding. During this period, the woman does not suffer the side effects of anemia for the loss of blood, since the process is hormonal rather than pathological, and basically this area is separated from the woman's circulatory system in preparation for the embryonic content that will eventually form the fetus.